Hello everyone, once again welcome to my Oet channel. So today we are going to discuss regarding the Oet letter which came on 3 December 2022. So I got some information from my students, but I'm not sure regarding the case, not exactly, but with the information we can do the introspection, and in between I will give you the sample letter also, the content of sample letter also. So once again I would like to tell you that it will not be exactly same like exam. This is informations from different students. Okay, so anyway we will start, and today's letter actually it is somewhat different from other case notes because in 2022 mostly we got letters to doctors and community nurses, I mean nurses and doctors, but this time the letter it was to physiotherapist. So after a long time physiotherapist, we got the letter to a physiotherapist, and the content is the patient's name is Elizabeth Hills, and she is 77 years old patient, and she got fracture last year. I mean November 2021 she got fracture in wrist, and they have managed with the plaster of cast. Then she was on rest. She was on rest in home with some exercise instruction, but she was in non-compliant with the exercise program. She didn't continue with these exercises. As a result, in between, she got some pain, inability to do the activities. So she came again to the hospital, and that means today she came back. Not today, I mean in previous visit. In previous visit, actually, they discharged with the instruction of DEXA scan after 2 months of initial treatment. So after 2 months, actually, she got the scan, and the scan shows osteoporosis. So we are actually osteoporosis specialist nurse, and she came under us, and we are following this case. In between, again she came back to the hospital. We gave instructions to continue exercises, but she is non-compliant. She is not interested to do the exercise at home. So an assistive service from a physiotherapist is essential for her. So this is the reason for her referral. So this is the overall summary of the exam, and now we can see like one by one what are the things that's happened. So we can see that they have given November, but I don't know the date when she presented to the hospital with the fracture. So actually they have given the month is November 2021. She came to the hospital with the right wrist pain and injury. So there was history of fall, so they were suspected fracture, and on x-ray the diagnosis was confirmed as fracture of wrist. So that they have given the plaster of cast application, and they have given the medication, but they didn't actually, the students, they didn't mention the medications what was exactly, and they have instructed follow up after 2 months with the DEXA scan report. So at the time of discharge they have instructed for DEXA scan. Then after 2 months, the DEXA scan revealed osteoporosis. So since then, I mean from then, we are following this case. And actually at that time we of course they used to give some medications, and along with that we have instructed the patient to do exercises at home. And but then the next appointment we could see that patient is refused to do the exercises. As a result, she's started to complain, unable to walk, and there is tiredness, she's weak and pain over the area, the fracture area, and some other complaints. But I'm not sure about how many visits she came to the hospital, but they have given like more subsequent visits in between from November to this January 2022. That means 8 January 2022. So it's like subsequently, we can write subsequently during the visits, or on subsequent visits, like that also we can mention. So today actually she came with the complaints that she's complaining that she could not walk, and the pain is increasing and decrease the standing ability, and we are suspecting that she may have another one fall because of this unsteady I mean inability, I mean she's unable to stand or walk freely. So there is a great risk of another one fall. So we are writing a letter to the physiotherapist to provide strengthening exercise. Actually, we have started strengthening exercises, but she's not following that. So for a continuous program, that means it's like a home program. Can be like a home program, home visit, through the home visits. We are just asking him to provide continuously, or within a time period. They have to set a time period to give the strengthening and stretching exercises. And what type of exercise also, I don't know exactly. And in the recommendation paragraph, overall the content will be exercises programs only, but I'm not sure about other recommendations. But anyway, with this scenario, we can just see how may be the sample letter. Okay, so this much only the content actually I got from the students. So with that, how we can formulate the letter. So as usual, the date of the exam is 8 January 2022, and we can write the date. The next one is the address, and if there is address, you can write complete address with the name, everything. If there is no address, you can start with the physiotherapist. The physiotherapist, the first letter should be P, and of course you have to add the also. Then the address, if it is there, you can write. Then we can start with dear sir or madam. If there is name, you can write the name. Then regarding Mrs. Elizabeth Hills, aged 77. In introduction, we have to write patient has two conditions. We have to write two conditions. First thing, patient is recovering from wrist fracture, and the second one is patient actively has osteoporosis. So these two conditions are important for physiotherapy. So we have to write like this. I am writing to prefer, or the purpose of this letter is to request, like that also you can start. I am writing to refer Mrs. Elizabeth Hills for further exercise program, who is recovering from wrist fracture and has osteoporosis. So like that you can write, or else you can write the purpose of this letter is to introduce Mrs. Elizabeth Hills, who is recovering from wrist fracture and has osteoporosis, full stop. She requires further exercise program from your service. So like that also you can write the introduction. So but don't forget to write two cases, I mean two diagnoses. One is recovering from wrist fracture and the second one is osteoporosis. So both are equally important. And the next present medical paragraph, we can divide into two paragraphs. In the first paragraph, we can write all the histories, what all things has happened until now. And second paragraph, we can, the second section of present medical paragraph, you can write about today's conditions and what all the things like you are indenting. It's like conclusion you can write. So how we can start? Always start with initially. If you want to tell some stories like long before, if it's happened, like 1 month before, 2 months before, something like that means. But if it is relevant to your condition means, you can start with initially. So initially, comma, Mrs. Hills was admitted to the hospital on, you can just write the name, I don't know the date, but it is November 2021, following a fall, and was diagnosed with a right wrist fracture. So you have to write was diagnosed because it is 2 months before. You could not write has been diagnosed. Okay, was diagnosed with right wrist fracture, full stop. Then you can write for which she was managed with a plaster cast and medication. So this medication, if it is given, you can write that medication list also. Then next thing you can write also, comma, she was advised for follow-up visit with DEXA scan report after 2 months. So that one also, it's happened during the discharge time. So you can write also, she was advised for follow-up visit with the DEXA scan after 2 months. Then we are telling regarding the scan report. Subsequently, comma, her scan report confirmed osteoporosis. So here another one more question, whether you can mention wrist fracture and osteoporosis again in the present medical paragraph. Yes, you can, because there are two conditions we have written in the introduction. So you can repeat the diagnosis only one time in present medical paragraph. There will not be no more issues. So subsequently, her scan report confirmed osteoporosis. And then what we did after the scan report. So we can write, therefore, comma, she was instructed for strength. I don't know whether it is stretching and strengthening exercise or any other type of exercises, but just I wrote here stretching and strengthening exercises. Therefore, she was advised, or advised already we wrote. So we can write instructed for stretching and strengthening exercises. Or else you can write, therefore, she has been initiated with the stretching and strengthening exercise also you can write. But we are not continuing in the hospital. Patient got discharged. So actually it is not a discharge also, it is like presentation. Patient like came for visit. So you can just start with the has been, or else you can just write like instructed for stretching and strengthening exercise, because she is doing at home. So you can write in that way. And you can just add these sentences also. However, she was non-compliant with the instructions, or she is non-compliant, no, non-compliance, not complaint, compliance, complianed. So she is non-compliant with the instructions, or she was also, you can write, no problem. So with that we can conclude the first paragraph of present medical paragraph. Then the next section you can start like this, that is today's scenario. Today, comma, Mrs. Hills represented, this represented should be hyphenated, represented with increased pain on wrist, comma, decreased mobility, and he is at high risk for another fall. So this is what we observed during this representation. Patient is complaining of increased pain. More than that, she's tired, she could not walk anymore, and she's unstable in mobilization. So that is the thing, just we are summarizing here. Today, Mrs. Hills represented with increased pain on wrist, decreased mobility, and he is at high risk for another fall. And what all the scenario they have given today's visit, you have to write. I don't know exactly what all the conditions she's complaining today. So with that, you have to write. Then, in addition, she is reluctant to perform exercises at home. So this is a main issue. We have instructed already, but she could not continue at home because she is 77 years old, right? So she could not do it alone. And another one more thing, I don't know regarding the social history also. Maybe she is living alone. So that may be the another one issue. Anyway, you can just write like this. In addition, she is reluctant to perform exercises at home. Therefore, assistance from your service is highly beneficial. So like that, we can just conclude. Okay. So she is reluctant to perform exercise at home. Therefore, or thus, assistance from your service is highly beneficial. With this one, we can conclude the present medical paragraph. So in this paragraph, actually, we wrote two things. What are the things? The first thing regarding the wrist fracture. What are things? At the time of admission, how she came, that means the signs and symptoms, and she was diagnosed with the condition, and we have done the plaster of Paris. Then medications, we have just instructed for the exercises. Not exercises, we have instructed for DEXA scan after 2 months. Then you can write subsequently after 2 months she came back with the DEXA scan report which revealed osteoporosis. Then of course there will be some medications or something, you can just add that one also according to the question. Then in addition we have instructed for exercises, however she is not following these exercises. Then today she represented, okay, revisited or represented, you can write because it is again and again the next time it's happening. With increased pain on wrist, decreased mobility, and what are the concerns they have given, what are the condition they have given, complaints, you can write there. So we are suspecting that there is another one, and there is a high risk for another one fall. So for preventing that, the muscle strength have to be increased. For that, we are requesting him to give some advices or assistance for exercises. So that is the thing we wrote. It's like a request. Therefore, assistance from your service is highly beneficial. Then the social paragraph, actually social paragraph, as I told you, I am not sure about that. You can write Mrs. Hill is married or widow, or what all things is even you can write marital status, and lives alone or lives with the family or something. So according to the case note, you have to write. And they have given it's she has high cholesterol and rheumatoid arthritis. If there is ER, you have to write she has had these many disease conditions since this year, respectively, like that you can write. And on medications, if it is given, you can just write maybe ibuprofen or atorvastatin or anything. If it is there, you can just write. Another one more surgical history they have given, she had parathyroidectomy, so that one also we can include. And the recommendation paragraph, As I told you, recommendation actually this is like a rehabilitative physiotherapy or physiotherapy like exercises, or there will be ongoing physiotherapy section. So I'm not sure about that. So according to the recommendation or plan, you can just write this one same like this. It would be beneficial or it would be appreciated if you could provide for further exercise program for Mrs. Hills at home to regain her physical strength and to prevent further complications. So like that you can write and you can sum up the letter. So recommendations mostly related to exercises only, so you can write in that way. So this is the sample letter for this case note. So of course, physiotherapy means you have to mention mainly regarding the physical stability, and what is mainly it will be related to the muscle strength only. So maybe the fracture or any accidents, or there is any muscle problem, the stability, I mean the what is that, the power of active and passive powers of muscles. So there will be some issues in these things only, and you can just think about what are the things we have given. You can just add medication also, no problem, but the important should be what are the exercises we have started already, and what is the current situation for the patient. So current situation means whether she can walk, whether she can do her by herself, or here means we just mentioned that patient have already osteoporosis, so there is more chance for fracture again. If there is a fall, of course there will be fracture. These patients are more prone to get fractures, so we are giving like additional information. That means there is prone to get fall, because she's already mentioning that she is tired and she could not move alone, the mobility is decreased like that. And even I think in social paragraph also there are some points, maybe she lives alone, and regarding the arthritis, she's already having arthritis and on medication. So these many things, it will be add the points to the physiotherapist, and in recommendation paragraph also it will be related to physical activities and exercise programs only. So it is in this type of letter, in case if you are writing the letter to physiotherapist, don't include any more medical histories, no need. Just whatever things is relevant to the physiotherapist regarding exercises, some medications related to these problems, and fracture, mobility, exercises, physical activity, walking, this, and if patient has any mobility aids, if it is mentioned, you can write. These are all the important points related to physiotherapist. So once again I will read the letter for you. So you'll just start with the date, 8 January 2022, and address. If there is no there's no name, you can just write the physiotherapist and the address. Dear sir or madam, if the name given, you can just write the name. Regarding Mrs. Elizabeth Hills, aged 77. I am writing to refer Mrs. Elizabeth Hills for further exercise program, who is recovering from wrist fracture and has osteoporosis. Initially, Mrs. Hills was admitted to the hospital on date then November 2021 following a fall, and was diagnosed with right wrist fracture, for which she was managed with the plaster cast and medications. You have to mention the medications if it is given. Also, she was advised for follow-up visit with a DEXA scan report after 2 months. Subsequently, her scan report confirmed osteoporosis. Therefore, she was instructed for stretching and strengthening exercises. However, she was reluctant or non-compliant with the instructions. The next paragraph. Today, Mrs. Hills represented with increased pain on wrist, decreased mobility, and she is at high risk for another fall. In addition, she is reluctant to perform exercises at home. Therefore, assistance from your service is beneficial. Then the next social paragraph is Mrs. Hill is, you can write married or widow or whatever, and lives with someone or alone. She has high cholesterol and rheumatoid arthritis as well as on medications. Please try to avoid and, two ands or three and in same sentence. Instead you can use as well as. She also, or in addition, she had parathyroidectomy. In the last paragraph, you have to write that it would be beneficial, or it would be appreciated if you could provide further or follow-up physiotherapy program Mrs. Hill apostrophe S Hill's home to improve her muscle strength and to prevent further complications. Then you can write yours. If there is name of the reader, write yours sincerely. If there is no name, you can write yours faithfully. Then you can write either registered nurse, or else you can write osteoporosis specialist nurse. The same designation what they have given. So I hope this is helpful for you, and if you are getting the case note instruction in detail, I will post the same letter with some more information, because it is not clear. Anyway, it's not clear for me also. The instructions are not much clear. There are no more informations. So just verbally I'm giving the sample letter, but when we will get clear information regarding the letter, of course I will post the sample letter in the YouTube with another one video. So until then, bye, take care.